Hashimoto's thyroiditis is an autoimmune condition first and foremost. That means your immune system has gone haywire and it is attacking your own body. In this case, in the case of Hashimoto's, your immune system is attacking your thyroid. Your job as somebody with Hashimoto's is to identify why your immune system is going haywire, identify the root causes and triggers, and then work on how you can mitigate those so that your body, your immune system, stops attacking your thyroid. Your symptoms stop increasing. Maybe they even go back to normal and you feel like yourself again. Welcome to the Health with Hashimoto's podcast. In this summer series, that is exactly what we are talking about. We are going to go over all of the most common triggers. If you want to go deeper or faster, head down to the show notes, click the link to the Hashimoto's Decoded Root Causes Revealed. In less than an hour, I'm going to walk you through all of the root causes and what you can do about them. You have a workbook. At the end of it, you'll have this map of exactly what you need to do next that will shortcut your time so that you can feel like yourself again. I am Esther. I am the host of the Health with Hashimoto's podcast. I am also a registered nurse, and I've been trained in holistic health education. That means when I am talking about your health, I am referring to everything: body, mind, spirit, diet, environment, because that is the whole you. And all of the root causes come through that whole person lens and affect each of those 5 areas. Let's talk about today's root cause through that lens: body, mind, spirit, diet, environment. We're talking today about vitamin D. Most of these are going to go in random order. I do not have like a significance or a priority list in my root causes, in the triggers of, when we're doing them in the summer. But vitamin D, I figured we should do first thing in the summer because it is in the summer that you can make your own vitamin D with access to the sun. You're not going to touch the sun. You know what I mean. So when you go outside during the summer and you are exposed to UVB sun rays, that is when your body can make vitamin D. Now, how much you make and how much sun exposure you need, it depends on where you live, like your latitude. It depends on the cloud cover. It depends on your age. It depends on how much skin is exposed. It depends on your skin tone, how much melanin you have. There's a lot of different factors in your vitamin D production in relation to sunlight. I cannot give you a simple formula. I cannot say if you live, at this latitude, go outside for X number of minutes every day and you should be fine. I can't say that because there's so many variables. I can tell you that if you live above the latitude line that goes through Chicago of the US, if you live above that, this is what I was taught in my holistic health education classes. They said you could be outside but naked all day long after the fall solstice and before the spring solstice, so all winter long, and you would not be able to make enough vitamin D from sun exposure because we just live too far north. Now, whatever latitude we're at, it would be the same thing if you live south of the southern latitude. It's distance from the equator. You need to have the right amount of UVB sun exposure. Also, if you burn, you're going to increase other risks. So when you are trying to get vitamin D exposure or when you're trying to build your vitamin D levels through exposure to the sun, you have to be smart. And I trust that every single person listening to this podcast is smart. You're not going to seek out a podcast teaching you how to be an advocate for yourself and how to take control of your health, how to be the CEO of your own health, how to identify root causes and fix them. You're not going to seek out a podcast that talks about all of these if you do not have some common sense. So I trust that you have some common sense. You have your brain going, and you can listen to what I'm teaching you, and you can apply it to your life in a safe manner. That is always the goal. You are smart. I trust you. So vitamin D is important for a lot of things. Now, people who take calcium might be interested in vitamin D because they're like, oh, I know vitamin D has something to do with my bones. And that is correct. Vitamin D and calcium and vitamin K2 kind of work in a triangle fashion to make sure that the calcium goes where it needs to go, not into the blood vessels, but rather into the bones. But vitamin D does a whole lot of other things too. We're talking about Hashimoto's and root causes. Every autoimmune disease has three things: a genetic component, a gut component, and one or more triggers. Vitamin D is a very common trigger. So vitamin D in your immune system, it acts kind of like the brake system for your immune system. It says, oh, look, I'm going to put the brakes on you right now because you are starting to go haywire and you're starting to attack too many things. So your vitamin D level actually tells your T cells, those are specific parts of your blood, specific parts of your immune system. The vitamin D says, hang on, don't go overreacting. Let's put the brakes on. And so, of course, if you have an autoimmune condition where your immune system is going haywire, we want to make sure that the brakes are in place, that your immune system has something saying, slow down, you're getting a little overexcited here. Let's do what we're designed to do. So you're probably asking two questions. Number one, how much vitamin D do I need? And number two, if I can't get it year-round from the sun, how do I get it? Now, you can listen to episode 9, where I go into a lot more information about vitamin D. I also have episode 62, which teaches you how to pick a vitamin D supplement, because on the whole, the vitamin and supplement industry is kind of shady. I do not trust most supplements. For example, fish oil. One study I read, I think it was 7 out of 10 that they pulled from the shelves were already oxidized. They were already rancid, which means they're doing more harm than good. They're not doing any good. They're only doing harm in the body. So I'm very, very picky and selective about what I choose to put in my body as far as supplements and activators. I'm not going to just go to, Target or Walmart and grab something off of the shelf. I want to know that it is third-party tested. I want to know about the conditions of the company that makes it and the factories, all of that. So episode 62 goes into that. But the basics, how much vitamin D do you need? It is not going to surprise you when I say nobody can agree. We've been around the block before. We know how the various health organizations disagree on everything, right? So there's two kind of categories of thinking. One is we need to prevent deficiencies, and the other school of thought is we need to give your body what it needs for optimal health. I'm assuming that you are in the latter category since you're listening to this podcast. But to prevent deficiency of vitamin D, when you get your lab tested, it comes back in ng per ml. So that's nanograms per milliliter. And typically less than 20 is considered a deficiency. Even up to about 30 is low or borderline. And then when you get to between 30 and 50, a lot of Western medicine doctors will say, that's fine. Whatever. At least you're not deficient. But if you're going for optimal, if you're going for giving your body what it needs to do what it's designed to do, then you're probably looking at above 50. Now, I have heard even higher. I have heard between 80 and 100. It seems like most people have pulled back on that, and it is no longer the current recommendation, even for the optimal health people. They say at least 50. To get that, it's going to depend on a lot of variables, like I already talked about. So you really do need to do some lab testing for vitamin D. I typically test once or twice a year. It's super easy and it's fairly cheap. You just get the little card in the mail, you do the finger poke, and then you send it back in. I always pull back on my supplementation over the summer because I can get my vitamin D outside. So I make sure that I go outside and that I have skin exposed. I don't have sunscreen all over. I want to make sure that I am getting some vitamin D from the sun exposure. At the end of the summer, I want to make sure that my levels are fine, and I want to know what I am going to start out with for supplementation. How much am I going to need? So that's really your call. And again, go to number 62, episode 62, and I talk more about that. But vitamin D, you can't feel if you're high, you can't feel if you're low. I do want to release this root cause episode early in the summer so that you can get your vitamin D through sun exposure. I hope you have a wonderful summer. Come back next week and every single week week so that we could talk about different root cause triggers, or just drop down to the show notes, click the link, and take the Hashimoto's Decoded right now so you can get it a full understanding and start addressing your own unique root causes today. This podcast is for informational and educational purposes only. Please discuss any changes with your trusted healthcare provider. To take your next step, join our school community and explore the courses available there. You do not have to figure your health out alone. So that is school, SKOOL.com, and it is the Health with Hashimoto's community. I'll see you next time on the Health with Hashimoto's podcast.